Hey everyone, and welcome to MediByte. Okay, so if you're a parent and you've noticed some unexpected itching or, discharge in your young child, it can be really, really worrying. I get it. It's actually a super common concern, but it's one of those things that can make you feel kind of alone. So in this explainer, we're going to walk through this whole topic with some clear practical info to help you figure out what might be going on. And that moment of worry, it just brings on a flood of questions, right? Is this normal? Is it part of growing up? Or is it a sign of something more serious? Well, our goal here is to just cut right through that anxiety by giving you the facts. So let's start by figuring out the difference between what's normal and what's not. Okay, so first things first, we need to figure out what's just a normal part of a kid's body versus what could actually be a sign of a problem. And this is so important. Not all discharge is a reason to panic. Knowing the difference, that can make all the difference for your peace of mind. All right, let's break down what we mean by normal. For brand new babies, it's actually pretty common to see a little bit of milky white discharge in the first couple of weeks. That's just from mom's hormones during pregnancy, and it clears up all on its own. Then later on, you might see a bit of clear or white discharge a few months before first period starts. Totally normal. Now, abnormal is where we need to put on our detective hats. We're talking about discharge that's suddenly heavier or kind of clumpy, or if it has a gray, green, or yellow color to it. A bad smell is another big clue. And of course, if it comes along with any itching or soreness. So the main takeaway here, any big change in color, smell, or texture, or if your child is uncomfortable, that's your signal to look into it a little more. So what if you have noticed something that seems a bit off? What could be causing it? Well, here's the good news. Most of the time, the culprit isn't something serious at all. It's often just related to everyday things like simple irritants or hygiene. Yeah, the most common causes are just simple irritants. Think about it. Bubble baths, scented soaps, even the laundry detergent you use. All of those things can have chemicals that irritate really sensitive skin. Another huge factor is just hygiene. Little kids are still learning how their bodies work, and wiping from back to front can easily move bacteria where it doesn't belong, and boom, you've got irritation. Okay, so beyond those simple irritants, infections are another possibility. We're often talking about common bacteria like strep or staph that just got transferred to that area. Then there are pinworms. I know, not fun to think about, but they're a common childhood parasite and can cause some intense itching, especially at night. And here's another one to be aware of, particularly if there's a really bad smell: a foreign object. It's surprisingly common for a tiny piece of toilet paper or even a bit of fluff to get stuck and cause a whole lot of irritation. So let's get a little more specific. If it's pinworms, the classic sign is itching that gets way, way worse at night. On the other hand, a bacterial infection is much more likely to show up as a yellow or green discharge. See the difference? Noticing these specific details can be super helpful when you end up talking to your doctor. Okay, we do need to talk about something that's very sensitive, but it's incredibly important. In rare cases, these kinds of symptoms can be a sign of an injury or even sexual abuse. I know this is a really difficult thing to even think about, but your child's safety has to be the #1 priority. If you have any reason to be concerned about this, it is absolutely essential that you talk to a healthcare professional. They are trained to handle these situations with so much care, and they are your best resource for help and guidance. And that brings us to a really critical question. When do you actually need to call the doctor? Because while a lot of this stuff is minor and can be handled at home, there are some specific red flags that you should never, ever ignore. So what are these red flags? What are you looking for? Okay, first, a fever. A fever, along with other symptoms, usually points to a more serious infection. Second, a yellow or green discharge. That often means it's bacterial and probably needs treatment. Any discharge that's tinged with blood, that definitely needs to be checked out. And finally, if you see any sores, bumps, or anything that looks like a lesion on the vulva, that's your cue to make a doctor's appointment. Now, I know the thought of a doctor's exam in that area for a child can cause a ton of anxiety for parents. I totally get it. But it's so important for you to know that the whole process is designed to be as gentle and non-threatening as it can possibly be. So let's pull back the curtain and demystify what actually happens during that visit. Almost every time, the visit just starts with a conversation. The doctor will ask you about the symptoms, the history, that kind of thing. The next step is just a gentle look at the outside, just an external examination of the vulva. And listen, in most cases, an internal exam is not needed. If they do need to get a sample, it's usually just with a tiny, soft cotton swab. The whole thing is really set up for a child's comfort, and bigger tests, like an ultrasound, super rare.
Remember, the doctor's #1 goal is to figure out what's going on without causing fear or making your child uncomfortable. A good pediatrician really gets it. They understand the emotional side of this for both the child and for you, the parent. They'll talk you through every single step, build that trust, and make sure the whole experience is as stress-free as possible.
Okay, we've covered the causes and when to call the doctor. So now let's switch gears and talk about prevention. We'll also wrap up with the key takeaways so you can feel empowered with some really good habits. Prevention really just comes down to a few simple good habits. I'd say the single most important one is teaching your daughter to always wipe from front to back. That's a huge one. Also, choosing breathable cotton underwear instead of synthetic fabrics can make a really big difference. Try to stick with mild, unscented soaps and detergents to avoid any extra irritation. And last but not least, make sure she changes out of wet bathing suits or sweaty clothes as soon as she can. That just stops bacteria from having a party. So if you only take away a few things from our chat today, let it be these. First, this stuff is common. You are definitely not alone. Second, the cause is usually something simple, like soap or just a little hygiene mistake. Third, know those red flags. Fever, blood in the discharge. That means it's time to call the doctor. And fourth, remember that the doctor's visit is truly designed to be gentle and child-friendly.
And we want to leave you with one final thought to chew on. Instead of treating hygiene like just another boring chore on the list, what if we reframed it? What if we talked about it as a positive, empowering act of self-care? Teaching kids about their own bodies and how to care for them with respect, that's a lesson that is going to stick with them for their entire lives. We really hope this explainer helps clear things up and gave you some peace of mind. If you found it valuable, do us a favor and give it a like and maybe share it with other parents who could use it. And of course, don't forget to subscribe to MediByte for more clear, simple health info just like this. Thanks so much for watching.